This topic is transfusion-associated circulatory overload. Transfusion-associated circulatory overload, otherwise known as TACO, is a life-threatening blood product transfusion reaction that is caused by either transfusing a blood product too rapidly or from a client receiving a large amount of blood product over a certain period of time. In either instance, the circulatory system is unable to handle the amount of volume that's been transfused, and this leads to the development of circulatory fluid volume overload. TACO may develop during a blood product transfusion or can happen 6 to 12 hours after the transfusion has been completed. And risk factors for the development of TACO include being younger than 3 or greater than 60 years of age, or if the client has pre-existing cardiac or renal complications, such as heart failure or chronic kidney disease. Both of these conditions can affect the client's ability to manage and process the excess fluid volume that is within circulation. With an increase in circulating fluid volume, blood within the blood vessels becomes congested, and this can lead to an increase in pressure within the inner lumen of the blood vessels and lead to leakage of fluid from the blood vessels into the extravascular space. Therefore, clinical features include pulmonary edema, which can lead to the development of respiratory distress that manifests as dyspnea, tachypnea, hypoxemia, and adventitious lung sounds like crackles. Jugular vein distension and peripheral edema can result from venous congestion, tachycardia, as the heart works to push a larger than normal amount of fluid volume throughout the body, bounding pulses, and hypertension. When we suspect that TACO has occurred, we should treat this like we would with any other type of blood transfusion reaction. And if the blood product is currently infusing, we should stop that blood transfusion immediately. Once we do this, we want to position the client in a high Fowler position and apply supplemental oxygen. This will help to increase the amount of oxygen available for gas exchange and help to promote lung expansion in order to maintain adequate perfusion of tissues throughout the body. Diuretics are commonly ordered and administered to help remove the excess fluid volume from the body, and we should notify the blood bank and save the blood specimen in order for them to test it and make sure that the client has not experienced another type of blood transfusion reaction. Lastly, we want to monitor daily weights and intake and output to assess for any further fluid volume retention and for fluid volume loss.